Good morning, everyone. My topic for today's seminar is Role of Adhesive Technology in Fixed Partial Denture. It will be covered under contents. Now, what is adhesion? It's a molecular or atomic attraction between the two contacting surfaces promoted by interfacial forces of attraction between the molecules of two different species. The material that causes the adhesion is called as the adhesive, and material that is applied onto the surface is called as an adherent. Now, there are certain types of adhesions like the mechanical adhesion, diffusion, chemical adhesion, as well as the combination of the all the adhesion. So now you have to know about the criteria of adhesion, in which you have the certain terminologies like wettability as well as the contact angle. As you can see in the figure A, that the water has spread freely, okay, and it has a good wetting angle. That means the angle which is formed is 0 degree. That means it's a good wetting. Whereas whenever you see in figure B, the water on the acrylic surface has certain angle, that is 75 degree, and on the Teflon, when you can see, has an angle of 110. That means the wettability is less. Whereas when you talk about the figure A, you have the complete wettability, which has a contact angle of 0. So therefore, an adhesive with a low viscosity and low surface energy as well as low contact angle is always preferred. So now adhesion to the enamel is achieved through acid etching of the immobilized substrate, which substantially enlarges the surface area for bonding. So now whenever you etch the enamel with certain acids like the phosphoric acid, citric acid, oxalic acid, nitric acid, sulfuric acid, after you etch, there is something called as the microporous layers, which is basically formed on the enamel surface. After the formation of these layers, you apply this bonding agents. Okay, these bonding agents are either a bis GMA or UDMA, and this bonding agent will try to penetrate in the surface through the capillary action. Okay, this monomer will then polymerize into the surface irregularities and will form a functional micro tag. Okay, so these are the fundamentals of the resin enamel adhesion. So now whenever you talk about a dentine adhesion, you come across something called as a smear layer formation. So what is a smear layer? Is any debris calcified in nature produced by the reduction or instrumentation of a dentine, enamel or cementum or contaminant that prickles the interaction and underlying pure tooth structure. Now the thickness of the smear plug is basically 0.5 to 10 micrometer. In order to overcome this smear layer obstacle, a certain degree of etching is required before the chemical bonding to the dentine regarding to the bond, the strength and durability of adhesion to the dental hard tissue. Now, whenever you talk about a dentine bonding agent, you have either a conditioner or an etchant, then you have a primer or an adhesive, and then you have the adhesive bonding agent or the bonding resin. Okay, the etchant, okay, the primer and the adhesive. These are the three basic things that you have to remember when you're talking about the dentine bonding. Okay, so now whenever you talk about the basic structure of the adhesion, you have something called as MRX. M is the hydrophobic part, R is the spacer, and X is the hydrophilic part. So whenever you talk about the hydrophobic part, basically reacts with the restorative resin. R is a spacer that is basically responsible for making the molecule that are large enough to keep the methyl acrylate group spatially located, whereas the X is the hydrophilic part that displaces and wets the surface. It basically permits the penetration into the porosities. Now, whenever you classify the dentine bonding agent, they can be classified according to generation. First generation is basically ignored the smear layer formation. You have basically a weak bond in this. Okay, in the second generation, then they came about giving some sort of uh, giving some sort of layer to the smear layer. Okay, some sort to the smear layer in which the bond strength is approximately 1 to 10 megapascal, but there is an inadequate hydrolytic stability in the oral environment which will lead to micro leakage. The third generation is basically the partial removal of the smear layer, and the bond strength achieved was still not adequate. Now when we talk about the fourth generation, is a total etchant technique in which they have completely remove this merely, and there's still consideration as a gold standard for dentine bonding. Whenever you talk about the fourth generation, has an etchant, primer as well as the adhesive. So they have considered the removal of the smear layer. The examples are all bond 2 and OptiBond FL. Whenever you come on to the fifth generation bonding agent, it was introduced in mid 1990s, which has a combination of primer as well as adhesive in one bottle. Okay, so they have combined primer as well as adhesive, and the etchant is separate. Okay, whenever we talk about the sixth generation, in which you have was introduced in the late 1990s as well. Okay, in which you have the self etching primers. That means the primers are joined together. Okay, whereas the adhesive is separate. Okay, and sixth generation had two different types, in which you have all on one bottle. Okay, that is the sixth generation. So the type 1 has an example of prime bond NT. The type 2 has an example of adoptal prime touch bond. Now this is an example of sixth generation. Now whenever you talk about the seventh generation bonding agent, you have various examples like I bond, G bond, and Xeno IV. When you talk about the eighth generation, you have various nanofill particles which are basically present inside the bonding agent, which has a particle size of 12 nanometer. These are highly in vitro bond, okay, good bond strength as well, okay, and they can be easily used to etch the enamel surface. Now, whenever we talk about the indications of the adhesion in your fixed partial denture, the first is the for the luting, second is for the direct restoration, third is for the indirect restoration, fourth is for treating the dental hypersensitivity as well as a tray adhesion. Now, when you talk about the adhesives which are used for luting and restorative purpose, let us talk about the classification given by Schielenberg. Okay, first they are classified as non-adhesive, micromechanical bonding, and the molecular bonding. Then, according to Rosenstein, they are classified as the interlimb luting cements and definitive luting cements. This definitive luting cements can be either a water-based or a resin-based. The water-based are basically classified as zinc phosphate, zinc oxide eugenol, glass ionomer cement, resin ionomer cement. Whereas the polymer or the resin-based can be classified as the polymerization as well as the adhesive schemes. This polymerization can be a dual self-cure or the light cure, or the adhesive schemes can be total edge, self-etch, and the self-adhesive. So whenever you classify this adhesive cements, they can be either a water-based adhesive or a resin-based adhesive. Okay, this water-based adhesives are either a glass ionomer cement, okay, and this resin-based adhesive are the adhesive-assisted resin cements as well as self-adhesive resin cement. There are various examples of all these cements. Now, when you talk about the adhesives which are used for desensitization, are basically dentine hypersensitive is the most common clinical condition which is difficult to treat, and it's most common in the cervical areas. Mostly after a composite restoration, you will basically feel this type of a desensitization. So you basically prescribe the patient with either a desensitizing agent, okay, in the form of a toothpaste, okay, or you apply a bonding agent and then you basically cure it. So these are all the example of these are the Gulma desensitizer as well as Scotch bond multipurpose. Whenever we talk about bonding of an indirect restoration, okay, they can be either a partial coverage bridges as well as full coverage bridges. Now, whenever we talk about the partial, the first thing that you talk about the partial is that you have the cast perforated resin bonded, whereas the etchant bonded FPD as well as a chemical bonded FPD. So there are various techniques to basically bond these. Now, in this figure is basically the partial bonded restorations, which are basically bonded, okay, using the adhesive resins as well. Then coming on to the fiber reinforced resin bond, which are basically used for the replacement of a shorter anterior span, which are basically also used in the temporization purpose. So now, whenever we talk about the minimal preparation of the abutment, measurement of the fiber length, you need to check the fiber length. Okay, whenever you talk about the fiber reinforced resin bonded FPDs. Now what happens in this fiber reinforces that a fiber is stuck whenever the teeth is missing, the fiber is stuck in between the two teeth, okay, and this fiber will then help you to bond the composite over it. So these are the examples of the fiber reinforced FPDs. Now coming on to the adhesives in metal ceramics. Now this adhesives in metal ceramics can be chemically modified, like they can be either tin coated, they can be changing the surface chemistry by silica coating or tribochemical coating, and also application of specifically formulated metal primer. This tribochemical coating can be either a chair side or a laboratory. If it's a chair side, there's a system called as cojet, and if it's a laboratory, it's a system called as Rocatec. So these are the adhesives which are used for bonding the metal ceramic. Now, whenever you talk about the ceramic repair, using a cojet with the cojet sand, what you need to do is that you need to load the cojet sand in a clean, dry container. You need to coat the part of the ceramic to be repaired easily. Okay, then you need to apply the sealant. Okay, and then you need to moisten the area, and then you need to bond the area with the visco bond, and then you need to complete with that of the composite. So this is how you let us see a video in which you have to basically use a micro etcher system.
Micro etcher is Denture, and it comes in this little case. I put these little stickers up that comes with it.
So this is the container which is basically used to fill that coated system, and you have this tubing, okay, in which you basically switch on and basically sandblast. This is the chair side coated system.
Oxide, I happen to like using 7 micron.
So this is the 50 micron alumina, which is basically kept into the small container.
Technique, we need to lightly sandblast a step into go, except that the purchase a little adapter that allow you to connect and just put it in the bracket table for you to use. So I'm going to take surface, and you can see how the thing that's kind of cool about this is that there's just not a lot of debris.
So now there was a study which was basically done to check for the resin cementation of zirconia ceramics with different bonding agents. The aim was to evaluate the effect of sandblasting and different chemical bonding agents on the shear bond strength. So the method one was basically they compared the control. Grade 2 was the sandblasting, in which 3 was the sandblasting plus they applied the monobond S, and in 4 they did the sandblasting and monobond plus, and 5 sandblasting plus Z primer plus. So this all the specimen in the groups were basically bonded with a conventional composite resin, that is the video link. So the result of this group was that the use of adhesive phosphate monomer contained bonding agents following the sandblasting is an effective factor for achieving the resin cementation. So let us see how the posterior zirconia cementation basically happens. It's basically done using the adhesive resin only. First you need to, this is an overlay which they are basically cementing, okay. So they are checking for the finish line, then they check for the high points, okay. Then they apply agent.
Or you can blot it dry. This with a crystalline solid etched in between each one.
After which they apply the adhesive resin, okay, and then they will cure it.
So, like I said, it's difficult to take down on a bite stick, but I guess you know they're flexible on the top, and yet you can put a lot of force to get all of your restoration.
So now whenever we talk about the surface treatment for ceramics, there are surface treatment increases the surface energy on the restoration, thus by promoting an effective bond with the resin. So whenever we talk about the mechanical union is basically achieved by sandblasting with the aluminum oxide particles and condition certain silan that promotes the additional chemical bonding. So this silan is a bifunctional molecule that reacts with the inorganic particle of the ceramic through the inorganic and the co-polymerized resin cement through the organo-functional radical. Now whenever we talk about the surface treatment protocol, now the surface treatment protocol, you can basically do it by sandblasting it. Then you need to etch the enamel surface with 9.5% of the hydrofluoric acid, and then you need to wash, and then you need to apply the silan coupling agent. So this is how you basically bond the all ceramic. You need to apply, you need this, okay. Then in the internal surface you need to etch it with the 9.5% of hydrofluoric acid. This is basically used to etch the crown surface. After that you basically you view the internal surface, you will see a frost dry appearance. Then you need to apply the sealant into the crown. Then you need to do the gingival retraction, that is basically placed on the tooth surface. You need to apply the etchant, and then you need to basically after the this is applied, you need to place the crown with the cement. Next is the veneer cementation occurs. Now, veneer cementation also occurs as I explained of the all ceramic. This is an unetched intaglo surface. Okay, you need to apply 10% of the hydrofluoric acid onto the internal or the intaglo surface of this. Then you need to apply the surface. This is basically, you'll see a first dry appearance. Then you need to apply sealant agent. After the application of sealant agent uniformly, you need to leave it undisturbed for 5 minutes. Then you need to surface treat the tooth surface. Okay, then you need to protect the adjacent surface with the Teflon. Okay, you need to acid etch the enamel and the dentine. You need to rinse it for 20 seconds. You need to dispense in the adhesive. Okay, then you apply a thin layer of adhesive. Okay, then you need to eliminate the solvent, apply the layer of adhesive onto the intaglo surface, put the resin, and then you need to cure it. You need to place it in the patient mods, and then you need to cure it. It's miscellaneous use in the tray adhesive. Okay, so you need to basically apply this adhesives onto the tray, and then you need to take an impression so that the impression material doesn't come out of the tray. So now the composition of this tray materials can either be a polyvinyl impression. For polyvinyl siloxane impression material, you need to basically use an ethyl siloxane or polymethyl siloxane. For a polyether base, you need to basically use a butyl rubber, okay, or a sterolin. Or for an alginate impression, you need to basically use a isopropyl alcohol polyamide. Now, what are the role of the adhesive in implant restorations? So that this cement, which most oftenly used in implant dentistries, are basically the zinc oxide eugenol, polycarboxylate, zinc phosphate, and rarely the composite resin, which is basically preferred. Now, each abutment, like the zirconia, the titanium, and the all ceramic, will have different cements, which will basically prefer. Now, if it's a PFM crown, and you need to cement a gold restoration, you will basically use a zinc oxide eugenol. You basically take a titanium abutment, you basically take a PFM, then you need to take a polycarboxylate. So depending upon the material, as well as the depending upon the material of the abutment, you will have various different cements. Okay, so there are certain recent advances in the adhesions which you need to know. Now there are certain fluorescent sensors which are being added to the luting agent, and they will basically detect the change in the matrix of the color, and if there is any micro leakage or the recurrent caries can be detected using these this fluorescent sensors. Okay, and then you have certain adhesives which have the bioadhesive proteins. Okay, these are the polypeptide analogs which are added, as well as the therapeutic properties. Uh, this adhesives might have certain therapeutic property which will help in remineralization, that has basically added of bone morphogenic and alkaline phosphatase. So to conclude, adhesion and adhesives are revolutionized restorative dentistry. While there have been many advances in adhesive dentistry over the last decades, the accelerated distribution of the information from academics to private practice is a challenge at times and should be act in the clinical practice. These are the references. Thank you.